Hello, and welcome to Med News Week, the rising leader in global medical education. You're watching Medical Spotlight, where we highlight the inspiring stories and pioneering research innovation of medicine's rising stars and global leaders. Hello, and welcome to Medical Spotlight. I am Jan Leifman.
I am Madhuri Balasubramanian.
Today, we have with us Dr. Arianna Gianakos from Yale University. Dr. Gianakos is an attending orthopedic surgeon and assistant professor at Yale Medicine, Orthopaedics, and Rehabilitation. She completed her foot and ankle orthopedic surgery fellowship at Harvard, Massachusetts General Hospital in Boston. Following her training, she became the first in-office needle arthroscopy and foot and ankle surgery sports medicine international travel fellow. She then fine-tuned her skills with the world-renowned surgeons across the world in New York, London, Amsterdam, Italy, and Greece. She's been working towards completion of her Ph.D. at the University of Amsterdam with an area of focus on gender differences in foot and ankle orthopedic surgery. Now, aside from being an internationally renowned peer-reviewed author and highly sought-after academician, Dr. Gianakos is also one of the founding members of Speak Up Ortho, where she's leading a Speak Up coalition call to action initiative, and is also a physician advocate in Physician Just Equity. She's recently been awarded the Women in Medicine Summit Trailblazer Award and recognized with the first ever Ruth Jackson Orthopedic Society Courage Award for her work. She's also a very passionate mentor who serves both as a leader and educator. Now, Dr. Gianakos, behind every person in a white coat is a story and a mission for why they pursued their journey. Tell us more about yours.
Well, first and foremost, thanks for having me today and inviting me to speak a little bit about, my profession and path in medicine. I think one thing I've learned is that everyone has their own unique path and there's always twists and turns. And, it's really how you respond and adapt to things that really can get you to your goal. And for me, I actually didn't think I was going into medicine to become a doctor. When I first was going into college, I was thinking about physical therapy and maybe going into a physician assistant program. I didn't have any doctors on either side of the family at the time, but I was exposed in high school and into college to orthopedics because I, just like so many other athletes, and I say athletes loosely, I do miss those days. And I look back now and I say, oh, how did I run that far or jump that high? But anyways, I had a couple surgeries, 2 ankle surgeries and knee surgery, and was introduced to some really incredible mentors at that time, and really loved orthopedics and loved just helping patients get back on their feet. So I was a little bit of a late bloomer where, towards the end of college, decided to consider medicine. Once again, not having any exposure prior to that, I didn't know if I could really be a surgeon, though, at the time. I was initially thinking of going into pediatric non-op sports medicine. And once again, during my early phases of medical school, I was introduced through research actually at the Hospital for Special Surgery to both Dr. John Kennedy and Dr. Joe Lane to, the field of orthopedics and how research was needed in orthopedics. And I really loved my time. And it was once again, late bloomer during medical school that I decided to apply for orthopedic surgery as a residency program, and ended up falling in love with the field. Really enjoyed sports medicine and foot and ankle surgery because I felt that there were a variety of cases I could do. There also was an abundance of research that was needed in this field. And I was very fortunate to receive some great training with wonderful mentors at Mass General, at NYU, and then once again over in Europe, particularly to really hone in on my skills. And now, I'm starting off at Yale, and it's been great in Connecticut. And I get to work with residents and medical students and try to hopefully be that person that I wish I had as I was going through training for others who are following.
Thank you, Doctor. That's honestly sounded so interesting. And, there's something that you'd mentioned about your background, like how you're so passionate about what you do. And you definitely have a huge passion in advocacy. Can you tell us something a little bit more about this and what are your initiatives that you take?
Yeah, so, obviously when you go into orthopedics, your primary goal is to come out being a great surgeon, right? And being able to take care of patients and whatnot. But one thing I found during my training was that we needed more physician advocacy and advocacy for each other. And any field of medicine is a high stress environment. And there's a lot of, you take a lot of that home with you. And so well-being is really important so that we can provide our best patient care. But one thing I also noticed when I was in training was that not all programs in training were created equal with regard to leadership and the treatment of the residents and the treatment of the medical students. And I've had some incredible mentors, both men and women, who have really supported and been my pillar. But then I also was exposed to what people don't like to talk about, which is the bullying and the harassment, the sexual harassment that sometimes is swept under the rug in the training situation and environment. And I remember at that time how hard it was to stand up for myself, because there's this power dynamic between attending surgeons and junior people, and then having to go to fellowship and get a job, that it's a really scary place to be in. And I felt trapped and lost at times. And I was lucky to have great family, great friends, and great mentors who, who believed in me and said, this is what you're meant to do and meant to be, and you should stand up for yourself. And ultimately, I band together with a couple of wonderful women in orthopedics who were leaders in the field to create a group called Speak Up Ortho. And Speak Up Ortho was this initiative to raise awareness about hostile work environments, not just for trainees, but for even seasoned, professionals. We all experience this every so often, unfortunately. And, we raised awareness and then developed a call to action where we wanted to improve the work environment for our medical colleagues, so that we could train in a place that we feel safe, reach our potential without feeling these negative effects of bullying and demeaning types of behavior that unfortunately are still prevalent in medicine. And this initiative took off. What we didn't realize was that people from even other subspecialties were reaching out, calling us saying, this is still going on in our specialty. How do we make it better? And we really came together with leaders across the country, and then ultimately even across the globe, because it's not just in the US that this happens, to team up to really start to determine ways that we can make sure that our students, our residents, and our colleagues feel safe, supported, and respected as they're managing their patients, so that the patients get the best care possible.
Thank you for that. And thank you for being a pillar of advocacy, and in many ways, the voice for the voiceless. You did speak about your Speak Up Coalition and Call to Action initiative. I believe you're also involved in Physician Just Equity. Can you chime more about that? Thank you.
Yes, absolutely. Physician Just Equity is this incredible group. It was started by Dr. Pringle Miller, who is a surgeon as well. And she came together and said, she saw that there was this problem where people couldn't really stand up for themselves. Conflict resolution the dialogue wasn't there because there were power dynamics, and people didn't know where to turn when they were having an issue during their job. And so she got a group of doctors as well as lawyers who were passionate about this and passionate about helping others together to provide peer support. And essentially, it's on their website. You can click in and you say what's going on, what maybe situation you're in, what you need help with, and she will help pluck people who might have some background and experience and put them together on a call with you, all volunteering their time for this, mind you, to sit down and try to work together to figure out the best path forward for the person. We've all been through adversity, and sometimes the worst feeling is feeling that you're alone in what you're doing. And so this group is it's just made up of amazing volunteers who they don't want people to feel that way, and they want to help work through outcomes, to avoid escalation of problems, avoid people dropping out or quitting, avoid lawsuits and what have you. And it's something that you can look up Physician Just Equity. You can go on the website. You'll see the list of peer supporters. You can also volunteer to get involved. And it's a really nice way to be there for someone who is just trying to navigate the field and is, in a situation that, most would never want to be in.
No, I definitely agree with what you're saying, Doctor. And I definitely am looking for and definitely do have such amazing, passionate mentors as well. And to speak a little bit more about that, you yourself are so passionate about mentoring, especially not just in academics, but also collegiate sports. Can you tell us what inspired you to do this and how this has kind of impacted for you as well?
Yeah, I think that's something that I realized as I'm now on the other side of training and now the attending when it comes to my patients and my residents and my students is that I always want, and I said this a little earlier, I think we should always try to be the person that we wished we had when we were going through maybe challenging times. We should always think back to how were we being taught in the operating theater? How are we being taught in medical school? How did we feel? Were we respected? Obviously it's patient care is number one. So there's gonna be times that with high stress that, you might get in trouble for something or you might get yelled at for something. But as long as the respect is still there, and at the end of the day, it's all about your growth as a trainee and, patient care, that's good mentorship. And so for me, I think I realized that when I found my own personal mentors, the importance of how much they inspired me to stick with everything that I was doing, to, reach my potential, just to be there for moral and emotional support too. I saw how they helped shape me into the surgeon I am now. And I think that when we owe it to those following to do the same, because once we were helped, it's time for us to pay it forward as well.
Thank you for the amazing work that you do. As humans, we're all dealt with setbacks, and they can make you or they can break you, kind of like a glass half full, glass half empty perspective. Would you mind reflecting on a challenging time in your life and how you'd suggest one approach these speed bumps to achieve academic success? Thank you.
Yeah, so I totally agree that, in order to reach your full potential or get to your goals, it's never a straight line forward, and there are going to be setbacks. That's life. And you're not going to win everything. There's going to be failures and disappointments, but that's how you grow. And like you said, it's how you look at these situations and instances and how you respond to it that will ultimately dictate, where you go forward in the future. So for me, I recently just gave a talk on because a colleague of mine had said this to me and it stuck with me, and it was turning pain into power. And because I think we do experience a lot of pain depending on what that may look like for each person, and it's how you can take that pain and channel it to something positive in order to create power from it and rise up. I will say that my training during residency was an incredibly challenging time for myself because I did experience the sexual harassment and abuse that people should never experience during any point of their life. But it's something that, it did make me question, is this the type of environment I want to be in? Is this how it is across the country? Or all these people, is this normal? And then I questioned even myself. Am I the exception? Why is this happening to me? What did I do? You blame yourself sometimes when you're going through challenging times. And it took a lot in me to look deep down to develop that inner confidence to say, no, I know who I am. I'm sticking by, the person I am, and I'm not going to change who I am just to fit a mold, and that I can be a bubbly, happy, joking person and still be a great orthopedic surgeon, right? You don't have to fit this mold. And so it took me years though to develop that inner confidence. So I think that, it's one of those things that when you're going through something challenging, you do need to rely on your support system. You need to talk to people about it and find those mentors who will support you through and lift you up during challenging times. But then also remember, you've made it this far, and that's because of your hard work and your dedication. And so, I think my piece of advice is to not let anyone else tell you who you should be and how you should act and what you should do. If you have a goal, stick to it, and don't be scared to stand up for yourself if you know deep down in your heart it's the right thing for yourself and for others.
Honestly, I'm truly empathetic to your experiences, and I'm really also thankful that it has made you so much stronger and that you're able to give back to all of our people as well in your initiatives and thoughts. We have a lot of younger trainees in our audience members as well. And given all of your career success, what's like one piece of advice you would give to them?
Well, I think I probably have said it a little bit already, but to reiterate, probably my most important things I think is number one, find your mentors and find people that support and have your best interests at heart. And that might be hard to do initially, but a lot of the times this happens organically. But I also think it's important, even if you find your mentors, thank your mentors, show appreciation. A lot of the times these individuals are taking time out of their busy schedule in life to help you and to talk to you and to be that shoulder and to help guide and navigate. And I think people forget that a simple thank you goes a long way. So show that appreciation and go that extra mile to say, you know what, I know you're doing this on my behalf. And then to reiterate again from before, if you have a goal and you have a dream and you have a passion, don't let other people dictate, if you can achieve that or not, or who you have to be like and what kind of person you need and how you should act. Be true to yourself, because that's the way you're going to care for your patients best.
No, I definitely agree, and really happy for you to share that small bit of information for the ones who are just getting in as well. So, thank you so much for sharing an enlightening discussion, honestly, on your unique background, your experiences, and how your initiatives were started as well. To go a little bit more, given that you are definitely involved in, extreme pioneering research in gender and sex differences in orthopedics, could you, elaborate a little bit more on that? Tell us what it is and everything.
Yeah, absolutely. So as you both know, I do enjoy research, even though I know how tedious and hard it is. It's one of those like love-hate relationships that I'm sure all of us can understand and be empathetic towards, because it's, obviously we wouldn't be here if we didn't enjoy it, but we do know it's really hard work and dedication to do that. But when I was in my residency, I had always known that, women tend to have higher rates of ACL injuries and knees, and certain injuries and knee complaints and hip complaints are different between men and women. But none of that research was really translated fully down to the foot and ankle, which was more my specialty. And a lot of it, even in the other body parts, was still lacking. And so I had started initially, when I was considering my PhD in this area, by first looking at all of the literature that had been published over the last 10 years in really high impact orthopedic journals. And I did initially a generic look at this, meaning multiple generic orthopedic high impact journals, to see how are we evaluating outcomes? Are we looking at them? Are we controlling for them? And what we found is that most studies actually don't even control for sex-related / gender-related differences in outcomes, in injury presentation, in complication rate, and about 30% overall did. And what was interesting was that of that 30%, almost half of those did find some sort of statistical significant difference in what they were evaluating, assessing for. So we went a step further and looked at this in sports medicine world and foot and ankle world. And once again, the numbers were pretty much the same, with this high rate of people not doing the studies where they're looking and controlling for these variables. And so we don't really know what differences exist. And that was sort of the background as to why I really got invested in this. And so then I translated all of that into more clinical studies, where I started looking at presentation of osteochondral injuries in the ankle joint. So cartilage injuries, where I was looking at ligamentous laxity, in lateral ankle ligament sprains and tears, medial ankle ligament sprains, how bone healing was different. And it really gave us this huge, amount of topics that we could dive into to assess, to see if there are any differences. And I think what is important is to know, even if there are no differences, that's still a finding that's important for us to know. And then slowly we start transitioning to, okay, if there are differences, what's the rehab for these patients? Are there differences in how we want to rehab women and men back in sports? And so that was really the focus and premise, because we're starting to see that there really are differences, both in clinical outcomes as well as even at a biologic level, with regards to hormonal differences and even genetic differences. And it's really exciting work. And then to spin off a little bit, some of the work work overlapped with some other new technological advances in foot and ankle, which are biologics, where we're looking a lot at the concentrated bone marrow aspirate and stem cell use, and also platelet-rich plasma use, and seeing where we can utilize these in order to enhance repair, especially as we're doing more minimally invasive surgeries. And once again, the spinoff to that was there's a new technique and technology of nanoarthroscopy, where we're using a 1.9 millimeter diameter camera, and we're doing things through poke hole incisions where you don't need sutures. And once again, we're doing this push to more minimally invasive biologics, your own stuff that's good to help the repair. And once again, how are these different between men and women? So it's something I'm excited to present on once I'm finally finished with the thesis, which hopefully will be in the next 6 months to a year.
Thank you for discussing your amazing pioneering work. Regarding platelet-rich plasma, I would imagine athletes in our audience and just athletes globally. In some cases, that can be a controversial field, depending where you receive the therapy. And just, would you mind elaborating for our audience who's new to this, really, what is platelet-rich plasma? That would be the first question. The second one is, how does one know, or how does one select an ideal provider to receive that therapy just to maximize the most promising outcomes? Thank you.
Yeah, the great questions. And, orthobiologics in general. So, for those listening in, that usually is some sort of therapy that is taken from your own body, right? So in the sense of platelet-rich plasma, you obtain that through a simple blood draw, and then it goes through a centrifugation system so that you get concentrated platelets and concentrated plasma, and that contains cytokines and growth factors and has some anti-inflammatory properties. And the goal of that is to incorporate that into a repair tissue in order to enhance repair and reduce inflammation. But we do see that there is a little bit of a lack of control sometimes with, providers who are administering them. What's their background? What's the science behind it? Is it indicated? Is it not indicated? It is somewhat controversial with regards to some of the indications, but what I'll say is that we have good evidence in the orthopedic world for a lot of soft tissue injuries. In foot and ankle specifically, there's been good evidence to support it in its use in Achilles tendon injuries, sometimes in plantar fasciitis injuries. And we know our sports colleagues a little bit more proximal in the leg are using it for hamstring injuries, and even more proximal rotator cuff. So a lot of the times it's been really nicely used for these more soft tissue types of injuries and it can help enhance the repair, especially for tendon, 6 to 8 weeks later. It really helps stimulate the repair of the tissue. Once again, everybody's different though. So the number of platelets that maybe you have is going to be different than myself or our listeners. So we don't know exactly what that content is for each individual, but there is good evidence to support its use in certain cases. Similarly, concentrated bone marrow aspirate is another one we often utilize, which has good evidence for, injuries like cartilage injury or bone healing if there's a non-union or malunion. And there's good evidence to support the use for these indications to help stimulate the repair once again. So it's still got a ways to go research wise, but I think it's promising. And like you said, the athletic population in particular, these individuals need to return to sport fairly quickly. So anything that can help reduce the recovery time and enhance repair tissue is, the goal for those cases.
Thank you, Doctor. And that was really interesting to read and learn a little bit more on PRP use for different diseases and how, it can actually be used, the treatment specifics, and where to go for as well. So my question's a little bit based on what you'd spoken about. And like you had mentioned, I've been recently reading a lot about female-based sport medicine research as well. So how can you say a little bit about in relation to the physiological aspect of the menstrual cycle? And does this affect the data already present? What changes can we see?
Yeah, so, it's interesting because I think we still have a ways to go with regards to this research. And I even though my specific PhD research is not looking quite as intimately with the role of the menstrual cycle. At the same time, I think that is the future of some of what we want to do to see the impact. There have been studies published that do demonstrate that during certain parts of the cycle, women are a little bit more lax in certain cases. So during that timing, you'd be concerned for an ankle sprain injury, rolling the injury. Sometimes even more, you can get some flat feet because the post-tib tendon starts getting overused and more lax too. So there are things to demonstrate that there is this relation. Some of the work has been done more in, ACL injuries in the knee, but it does translate down into foot and ankle also. One thing we had written up that I think also is deserving of future research is looking at foot and ankle changes, and then you could do any change in general during pregnancy, right? And the effects of hormones during pregnancy. We see patients come in and they develop, wider feet. There's a lot of swelling. They get flatter feet. Sometimes that doesn't even return back to normal depending on the person. They can get calf cramping. They can get, once again, you have increased risk of stress reaction in certain bones in the foot and ankle because of the hormone differences. So I think that I love that you brought this topic up, because I think that hormonal differences and changes even in one person alone can predispose a person to an injury. But I think that that's just where we need to go with some of our research to dive into that further.
Given the latest nanotechnology and nano approaches that you spoke about previously for orthopedics, can you please elaborate where it's currently being used and where you anticipate the next frontiers of this technology being used to improve overall clinical outcomes?
Yeah, so nanotechnology is something I'm actually very excited to talk about, because I think I obviously my focus in foot and ankle is a lot of sports medicine. So I do a lot of, I work with a lot of athletes, a lot of trying to keep this more minimally invasive. And so this new needle scope, once again, is 1.9 millimeters in diameter. So it's very small. So it allows us to see into a joint without having these big incisions. And it also allows us to do this without traumatizing the tissue when we're inserting all our instruments and whatnot. So I think at baseline in the operating room setting, it already is very beneficial in reducing the invasiveness of the surgery itself. And this can be translated not just in the ankle joint. People are using it in the knee, in the shoulder. You could really use the small scope in any joint to perform your surgery. What was additional training that I had done, particularly at NYU with Dr. John Kennedy, was using this technology in an office or procedure room setting under local anesthesia, meaning not going to the operating room for some of these cases that we used to always go to the OR, not using general anesthesia, not using a spinal or epidural, not even a regional block, but doing everything through portal local anesthetic with lidocaine, marcaine, and a little bit of epinephrine to reduce, any type of bleeding, and performing these more smaller procedures now in the office, where patients walk in and they don't need to gown up. They don't have to be in a hospital bed. They don't feel sick. They don't feel like they're undergoing this major surgery. So mentally, they are more inclined to want to get back to sport and get back to work quicker, because they just went in almost as if you were going to the dentist. And even though no one loves that, but going to the dentist for a procedure and then walking out of there, it's a similar concept. And the procedures are pretty quick, and you don't have to once again check into a hospital and do that whole, the whole day affair. And what's interesting is, because it's under local, the patient can actually look at the screen if they want and talk interactively with the physician who's doing the procedure to say, look, this is where you have, say impingement and then scar tissue that we want to take away. This is where, you have a little bit of a chondral injury and we're going to clean this up, and you can physically see it. So they become more interactive in their care, which I do think helps them understand their pathology, and then also understand their recovery a little bit better. So I think that's the direction that myself and some of my colleagues are starting to research and do some work in, to see how do we make this easy for people to do in a procedure room or office setting, so that things are, less invasive, with quicker return to sport and work.
Doctor, and that's honestly a good way for patients to just be less afraid of coming to a hospital, definitely, and just improving on the treatments and techniques as well. And we spoke so much about these techniques and treatments and everything. And something you had mentioned about was about stress and strain, which we know definitely are major factors influencing the growth, remodeling, and repair post and pre-op as well. So, is there any technology, tools, or any kind of instruments that you use that can help you kind of gain better insight into the complex behaviors of these tissues and how it kind of helps your treatments as well?
So, that's a great question, a little loaded question because we see so many various types of injuries. So some of this might be a little bit specific to the injury pattern. One thing I will say that I think we need more attention to is when I took a year off during medical school between my third and fourth year, and that was to do research in metabolic bone disease. And I did that at HSS with Dr. Lane, and we looked at osteoporosis, osteopenia, but we also just looked at metabolism in general. And I think sometimes we forget that that there is a metabolic role in these tissues that can affect outcomes. And so, one thing, so say for an example, say someone comes in with a fracture that is maybe minimally displaced, doesn't need surgery, or maybe even a stress fracture, right? Just a reaction in the bone, maybe that we know is, weak right now. Something I've started doing is incorporating vitamin D into the regimen. Sometimes I will run lab work and I'm looking at calcium, the vitamin D levels, the PTH, all these things that impact bone turnover and bone metabolism to say, how can I tweak my treatment so that this patient can have better outcomes? Not just this is my surgery procedure. I am starting to work and talk with other companies actually who have more of a nutritional supplement component where there are more anti-inflammatory medications that are not prescription, but it's all organic, like turmeric, ginger, all these different things that can come into play that are more organic in order to help with the recovery and repair of either muscle tissue, tendon tissue, bone health, whatever it may be that you're recovering from. So I think that we have some good evidence to support some of these interventions, but I think in orthopedics, we lose focus on remembering to treat the person as a whole, and that it's not just about that surgical site or that injury site. That's obviously a big part of it, but there might be other factors that we can think about and change and tailor, and it has to be very much individualized per patient.
No, I definitely agree. And that was honestly really interesting to learn about because, like you had said, it definitely depends on the disease, the body of the patient, and so many other factors as well. But I think this is definitely something we have to cover as well in terms of treatment. And thank you so much for sharing that. And honestly, we really appreciated the opportunity to learn so much about your work and yourself as well. We have just one last question for you. When everything is said and done, definitely, what do you still hope to achieve in your career? And what do you want to be remembered for?
These are deep questions. I like it though. So what do I want to still achieve? I think for me, one of the reasons I went into medicine in general is I feel like it is an ever evolving, career, right? You can, there's always something to learn, always something to investigate. So I think for me, I want to continue on the path where research, I'm more of a clinician scientist, right? So I want to treat my patients, but I want to support all the work I'm doing with the research that I'm conducting. I also think it's important to be at the forefront of research with these new technologies. So for me, I think continuing to move the needle in these areas of minimally invasive surgery, such as the needle scope and other procedures we're doing, as well as better understanding and individualizing treatments based on, just the person it's, themselves, or whether it be based on sex or gender, or whatever it may be, really continuing that work and completing that so that we have a better understanding for those following in my footsteps. And I think the goal for any surgeon in particular is just to be the best surgeon possible and to always keep training, always going to courses, always putting in the time and effort so that my patients, when I go into that OR, I know that I'm doing, the best for this patient and that, all that extra training is why they're coming to me. So I think that's probably a career goal. And the second question you had was, what was that?
What do you want to be remembered for?
Remembered for? this might be a little atypical, but I think for me, I want to be remembered that for being somebody who people wanted to work with, being somebody who people looked up to and respected and always knew was going to do right by my patients, right by my colleagues, stand up for them when they needed, be there for support, and just be an individual who just was known to help others, whether it be patients, colleagues, students, and who people can say, you know what, she inspired me to continue working hard even when I wanted to give up, or she inspired me to go into this because I saw how she treated her patients and I wanted to treat them so that my patients feel like they're really being taken care of. And I hope my patients remember me for that too.
Thank you so much for taking the time to speak with us and discuss not only your journey, but also your important work. How can our audience connect with you?
So I am on a variety of different social media platforms, so feel free to reach out anytime on those. My Instagram is Dr.Arianna Gianakos, so you can just write in my first and last name. My Twitter is @Gianakos, and I'm happy to provide these also to you as well. I think my Facebook is just my name, and LinkedIn is my name. So feel free on any of these platforms to reach out at any point. I'm always happy to answer questions, but I can provide you with all of those personal details, and people can reach out to your group and feel free to pass it along, because once again, I would love to answer questions as people navigate their field. And then also if people are interested in learning more about the technology we're working on, I'm happy to discuss that as well.
Thank you so much for being accessible, and thank you so much for your time.
Thanks for having me.